Hi there, I am Jacqueline Kinser, the owner of Holistic Lactation, and I'm an international board certified lactation consultant and a certified specialist in orofacial myology. And in today's video, I'm going to be teaching you all about paced bottle feeding. Now, you might have no idea what that means. You may have heard of this before and you're looking for a tutorial on it. Well, either way, I'm here to teach you what it is. Paced bottle feeding is a bottle feeding technique that I firmly believe should be used no matter if your baby drinks breast milk or formula, but it is especially important for babies who are primarily breastfed so that they don't end up preferring the bottle. That's a lot of breastfeeding moms' nightmare, and we want to avoid that. So it's really important that you get this technique down, and if you're not the one who's going to be there bottle feeding your baby, show caregivers, daycare centers, other family members who may be bottle feeding your baby this video so they know exactly what to do. And if you are a caregiver watching this video, it is really important that you honor the parents' wishes who have shared this with you. It is very important how their baby is fed, and not done properly, you could potentially jeopardize their breastfeeding relationship. So let's get into it. The first thing you're going to want to master here is positioning the baby for bottle feeding. So often in popular culture, media, what have you, we see a baby that's laying on its back and then being bottle fed like this. That is not ideal. Couple of reasons why is one, it's really hard to coordinate the swallow and the tongue movement when your baby's in this position. But the other is that we as adults don't lay on our backs and eat food. And that's because, again, swallowing is really difficult. Coordinating swallowing with breath is difficult. Babies shouldn't be breastfed laying on their backs. They should be laying on their sides or upright. Same goes for bottle feeding. You can utilize this technique with a baby in a side-lying position. Just make sure that their head is higher than their hips. But generally, upright is something that most people are going to do. If you're struggling to have a baby take a bottle, using a side-lying position may work extremely well for you. So here's a couple positions that you can use. One is you can hold the baby in the crook of your arm where they're at least at a 45-degree angle or more upright. You want to make sure that the head is able to freely tilt back, but it also is supported. The last thing you want is for their head to be forward. It's going to be hard for them to get a good jaw opening and good swallowing. They'll tend to swallow more air, throw the epiglottis off, and get hiccups at the end of the feeding. You can also hold them where they're more in a seated position and you're supporting the back of the head, letting it tilt back slightly. Sometimes parents like this a lot. I mean, you can certainly hold them facing outward, but one of the important things about feeding is that it can be a bonding moment. It's very much a regulatory behavior, so making eye contact with the baby while feeding is preferable. So I'm going to demonstrate this while holding the baby in the crook of the arm position. The legs are sort of folded, the baby's in a seating position on my lap, or if you have a long torso, maybe they're supporting your arms, maybe even have a nursing pillow or other pillow underneath the baby just to support them. So head is tilted back and nicely supported. The first thing you're going to want to do here is to have the baby latch onto the bottle. Much like breastfeeding, we don't want to really violate the baby's intimate space of their mouth where they connect and feed. You don't want to be shoving a breast in the baby's mouth. You don't want to be shoving a bottle in the baby's mouth. So you're going to tickle the lips with the tip of the bottle nipple, and you're going to have them open their mouth wide. This should stimulate the baby to do that, especially if they're hungry. Once they open wide, you're going to want to aim that bottle nipple at the roof of the mouth. Try to get it all the way in the mouth. My baby doll, unfortunately, does not have a mouth that opens wide, but their mouth should be covering the entire bottle nipple. This is a Dr. Brown's with a preemie nipple. It doesn't have to be this bottle, but you want to make sure the entire bottle nipple's in the baby's mouth. On this type of a bottle, the baby's lips should be touching this ring or very close to it. The lips are flanged out and relaxed. So when the baby first latches onto the bottle, you hold the bottle at an angle where the base of the bottle is down and the nipple is in the mouth. You do this because you don't want milk in the nipple right away. A lot of the reason why babies end up preferring the bottle to the breast, especially if the mom does not have a super fast letdown or a letdown that happens quickly in the feedings, is because the baby is used to immediate gratification. Meaning when we put the bottle in the baby's mouth, they get immediate milk and they have no reason to really work to stimulate the milk ejection reflex in the breast. So you want to let the baby have the bottle in their mouth, suck 5 to 10 sucks, and then you can tilt the bottle up. Now, some babies will suck a few times and they will take a pause. If that's the case, you just leave the bottle where it is and they will start sucking again. If they don't, then they're probably not hungry. So if they're hungry, they will start sucking and they might look a little confused. But once they've had their 5 or 10 sucks, you can tilt it up and let them have the milk. Notice the bottle is still mostly horizontal, so there's no reason to have the bottle, vertical or anything like that. In fact, you can see milk is already leaking out of this bottle nipple whether or not a baby is sucking on it. So if you hold the bottle, directly vertically, they're getting milk whether or not they're working for it. Now the baby is going to suck 20 to 30 times before taking a pause. Most likely. There could be some variation in there. So when they take a pause, you're going to tilt the bottle down, you're going to leave the bottle nipple in their mouth, and then you're going to let them suck again. Let them have a couple sucks, and then you tilt the bottle back up. Now, if the baby has been used to bottle feeding and has not been pace fed in the past, they're probably not going to take any pauses on their own. So after 20 to 30 sucks, I would say closer to 20, you're gonna wanna tilt that bottle down, let them have a couple sucks without any milk, and then tilt it back up. Now, for the baby who tends to be very gassy or burps a lot after feedings, you may want to take the bottle completely out of their mouth, sit them up, burp them after every ounce or so. But if the baby's voraciously hungry or doesn't seem like they're bothered, or you're not worried about them getting air, then you can just continue feeding, kind of doing this seesaw pattern throughout the entire feeding. Now, once the baby unlatches, or if you tilt the bottle down and they don't begin sucking again, then you take the bottle out of the baby's mouth and assume that they are done. Even if there's a little bit of milk left in the bottle, it's not worth overfeeding them and trying to push them into finishing the bottle just because you heated up that milk and you just want them to use it. Respect that your baby is done with the feeding. Now it's time to burp them if you'd like. And I probably would recommend that after doing the pace bottle feeding technique. So again, let's go over why this is helpful. This is extremely helpful so we don't overfeed babies. In fact, there's a study that's been done that showed that babies who are fed breast milk or formula in bottles, but the fact that they were bottle fed, both put them at increased risk of obesity at 1 year of age. Now, they think the reason for that is because bottle-fed babies are rarely pace-fed. So if they're overfed, their stomachs are getting stretched out, they're drinking way more than normal milk quantities and normal milk volumes, or there may be some misconception that breast milk-fed babies need the same amount of volume as formula-fed babies, which is not true. So either way, it doesn't matter what type of milk they had, they were at a higher risk of obesity at 1 year old. So what we want to do is make sure that we are reducing that risk of obesity when we are bottle feeding. We do not want to add to it. The other is that if you stretch out your baby's stomach and they're taking more than the max that of a breast milk fed infant should take, which is 5 ounces, it should be anywhere from 2 to 5 ounces per feeding. Let's say you have a baby that's taking 6 ounces. Well, now their stomach has been stretched out beyond the normal capacity, and now a normal volume of milk is no longer going to make them feel satiated. They're not going to feel full, so they're going to continue to overfeed, taking those large amounts. And for a mom with a normal milk supply, she is not going to be making 6 ounces, for every 3 hours, right? So it's important to feed the baby, every 3 hours, 2 to 3 ounces, maybe 4. It's the rare occasion that a baby should be taking 5 ounces if it is solely breast milk. Formula is a different ball game entirely. But a breastfed baby is only ever going to take 2 to 5 ounces once they've kind of reached the 2 to 4 week mark of age. And that's not talking about preemies or any sort of special cases. So there you go, that's pace bottle feeding. I hope you found this video helpful. If you did, I'd love for you to subscribe, like this video, leave a comment, share with anybody that you think could use this important information, and I wish you all the best along your breastfeeding journey.